An acute allergic reaction or anaphylaxis is a life-threatening but rapidly reversible condition if treated promptly. Anaphylaxis can develop within minutes of injection and ingestion of medicines or contact with an allergen. The persons who are aware of the risk of anaphylaxis are to be informed of avoidance measures and may be taught the use of an epinephrine or adrenaline pen. Causes: bee or other insect stings, drugs, for example penicillins and sulfonamides, vaccines, antisera, for example snake serum, antitetanus serum, intravenous contrast media, foods like seafood, groundnuts, fruits, among others. The symptoms are severe itching, urticarial rash, facial and perioral swelling, difficulty in breathing, wheeze, collapse, and syncope. The signs that are usually elicited are angioedema, difficulty in breathing, bronchospasm with wheeze, tachycardia, hypotension, cold clammy extremities, facial edema, urticaria, and cyanosis. Investigations are FBC, that's eosinophilia, skin prick test for specific allergens, serum specific immunoglobulin E. The main treatment objectives are to secure airways, breathing, and circulation, reverse symptoms, remove the offending cause if possible, rapidly intervene and correct abnormal vital signs. Non-pharmacological treatment: to avoid the allergen and also resuscitation. Pharmacological treatment: for acute anaphylactic reaction, first line treatment, give oxygen by nasal prongs 2 to 6 liters per minute, or face masks 4 to 8 liters per minute. Non-rebreather max on is 10 to 15 liters per minute. Then you give adrenaline or epinephrine IM in adults 0.3 to 0.5 ml of 1:1000 solution. That is 300 to 500 micrograms, repeated if necessary every 10 minutes and while monitoring blood pressure and pulse. Children 0.3 milliliters of 1:1000 solution, that is 300 micrograms, repeats as for adults. Then you give hydrocortisone IV in adults 100 to 200 milligrams 6 to 8 hourly to control any late and allergic reaction that may occur. In children all ages, you give 2 milligrams per kilogram 6 hourly for 4 doses and not to exceed 250 milligrams per day. Then you give prednisolone oral in adults 40 milligrams daily for 14 days and you taper off. And in children 2 milligrams per kilogram daily for 14 days and taper off. And then you give promethazine hydrochloride IM in adults 25 milligrams. You repeat after 2 hours if necessary, and then 12 hourly for 24 hours. And in children 2 years to 12 years, you give 6.25 to 12.5 milligrams 8 to 12 hourly for 24 hours, and less than 2 years is not recommended. Or you give chlorpheniramine, so chlorpheniramine IM in adults 5 to 10 milligrams 6 hourly with a maximum of 40 milligrams daily. And in children 6 to 12 years, you give 5 milligrams up to a maximum of 4 doses in 24 hours. And 6 months to 6 years, you give 2.5 milligrams. And less than 6 months, you give 250 micrograms per kilogram with a maximum of 1.5 milligrams. Acute anaphylactic reaction with severe airway obstruction, you give the medications and you add salbutamol nebulized in adults 5 milligrams 4 to 6 hourly until resolved. In children 2.5 milligrams 4 to 6 hourly until resolved. Or aminophylline IV in adults 250 milligrams over 20 minutes and then continuous infusion by perfuser at 0.5 milligrams per kilogram per hour for 24 hours if necessary. In children, 3 to 5 milligrams per kilogram over 20 minutes as a slow bolus ingestion or by infusion in 500 ml sodium chloride 0.9% IV, 4 to 6 hourly for 24 hours. And then you add normal saline. That's what acute anaphylactic reaction with severe hypotension. So normal saline 0.9% IV, 1 liter to 4 liters. The rate is determined by clinical assessment. So referral criteria: you refer to district or regional hospital if symptoms of anaphylaxis persist after stabilizing the patient and giving initial treatment.